Hi, I'm Barbara Murphy. I'm one of the medical oncologists here at the Vanderbilt Ingram Cancer Center, and I work with the head and neck cancer team. You're about to watch a video that's going to instruct you about the side effects that can be experienced by patients undergoing chemo and radiation. It's a rather long video. You will have multiple opportunities to watch the entire video or parts because they'll be available to you on YouTube. I think it's really important that you recognize that this is a general video and it incorporates a vast amount of information that is applicable to head and neck cancer patients in general. Once you've watched the video, you will have the opportunity to sit down and talk to your physicians and your nurses about your particular cancer and the issues that pertain to your particular tumor. In addition to the video which you will be watching, there is also an accompanying handout that will be available to you. Please keep that on hand for reference throughout your treatment and actually as the time passes after treatment is completed, because it's going to have some important information about things that you need to do long term in order to be able to maintain the best health possible. So let's go ahead and talk about the side effects of treatment. When we talk about side effects, we're usually talking about symptoms, things that you perceive as off in your body or causing problems. We think about symptoms with regards to two important factors. The first factor is where they're located. Local symptoms are symptoms that occur around the tumor or near a surgical site or within the field of the radiation therapy. An example would be mouth pain from radiation. You can also have general symptoms. These are symptoms that affect the entire body. An example of that would be fatigue due to either tumor or to radiation. We also think of symptoms as related to when they occur. Some symptoms are present before you're even diagnosed, and often those are the things that cause you to go to the doctor to find out what's going on. Treatment can cause acute symptoms. The acute symptoms are usually due to either the surgery, radiation, or chemotherapy. When you've completed all of your treatment, you can have symptoms that persist long-term or may develop long after treatment is completed. These are often referred to as late effects. Oftentimes patients will ask how severe their symptoms will be, and this is dependent on a number of things. First of all, it depends on whether or not you're getting chemotherapy with your radiation. When the two are combined, the symptoms tend to be more severe. It also depends on how large your tumor is and how far your tumor has spread. Patients with larger tumors or tumors that have spread to the lymph nodes in the neck more often need a larger area of radiation therapy, and this can result in increased side effects. Also, where the tumor is located. There are some areas of the head and neck where the radiation is more likely to result in significant side effects. Another dependent factor is how strong and healthy you are. The stronger you are, the better you'll tolerate your treatment. That's why we work so hard to make sure that people are well nourished and healthy. Finally, how well you work with your team to prevent and manage your side effects. You're an important part of making sure that side effects are kept to a minimum. Many patients want to know how treatment will affect their ability to function and to care for themselves. Symptoms are usually pretty mild for the first couple of weeks of therapy, so you'll be able to do most of your normal activity. After that, patients often become very fatigued, they become weak, they become forgetful and sometimes confused. This can last for several months after treatment is completed. During this time, patients need help with routine activities such as household chores, shopping, medical management, and transportation. Most patients can't work during treatment, so it's very important that if you have a job, you talk to your employer. You need to let them know about your medical condition and how it's going to impact on your ability to work, and talk about disability and when you can return to work at your normal level of function. Patients oftentimes ask, how long is it going to take for the treatment-related side effects to go away? So we've talked about the fact that symptoms worsen throughout radiation therapy. And it can take a couple of weeks to a month before the side effects start to subside. It can take months for side effects to really come under control. Let's talk about specific side effects. Pain usually starts getting substantially better after 4 to 6 weeks, but oftentimes patients are on pretty strong pain medication, including opioids, for several months. Some patients are on opioids long term. Swallowing usually improves within the first 2 to 3 months, and most patients are able to get feeding tubes removed within 3, outside 6 months. There are occasional patients who need feeding tubes long term. Patients often complain about thick secretions and taste alterations. These will generally get better within 3 to 6 months. But again, many patients will say that they have mild or moderate symptoms that persist long term. Finally, fatigue. Fatigue may take a long time to go away. Patients will usually say by 3 months they've recovered a significant level of their activity and strength. But many times patients will say they still lack the energy that they had before treatment, even 6 and 12 months after treatment is completed. It can be distressing to patients to think about having side effects that last a long time. But I do want you to know that when we ask patients 1 year after treatment, how's your quality of life? The vast majority of patients will say, it's just as good as it was before I started my treatment. The most common side effects that patients complain about a year or more after treatment include mild fatigue, persistent taste alterations, sensitivity to the lining of the mouth and the throat, which makes you sensitive to dryness or hot, spicy foods, mouth dryness itself, face, neck, or shoulder swelling or stiffness, and changes in the ability to swallow. For most patients, a year out from treatment, these problems are mild. A small percentage of patients present with severe side effects or develop severe side effects during treatment. These patients may have a really tough time getting over the side effects that they're experiencing. This may limit their ability to return to work. If that happens, we always work with patients to try and ensure that they get the long-term care that they require in order to have the most functional, highest quality of life possible. We've now completed the introduction to chemo radiation. What we're going to do now is have you go through a series of 5-minute presentations that will look at important aspects of specific symptom control issues. Through these short vignettes, you'll be able to meet with different members of the head and neck treatment team. Once you have completed all of these small segments, you will meet with your healthcare provider and she'll answer any further questions. Thank you and good luck.